This is Radio Health Journal. I'm Nancy Benson. This week, coronavirus, a global health emergency. But how much should we worry here?
We're going to see many more of those type of folks who are anxious and concerned when they really have no risk for it.
What coronavirus means to you when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
You have this wonderful opportunity to lose yourself in a creative analog task and to really focus on something and let the outside world just melt away.
The wonders of taking time to color. Then,
we doctors are the ones who are present at the most suffering moments of people's lives, and it's a gift to us.
The struggles of working in a broken system. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Thousands of cases, hundreds of deaths. The coronavirus in China has prompted a public health response unlike any ever seen before, with whole metropolitan areas there locked down. The World Health Organization quickly declared a public health emergency, and U.S. airlines curtailed China service. But the virus has still made its way to our shores and prompted the federal government to quarantine Americans for the first time in 50 years.
This is a new virus, and the Chinese microbiologist, the virologist, very quickly identified that this was a coronavirus, a novel one. They sequenced the genome and gave that information to the world scientific community lickety-split. Now, how the outbreak was handled is another matter and gets us into the healthcare system in China and how it functions or doesn't function very optimally.
That's Dr. William Schaffner, professor of preventive medicine and infectious diseases at the Vanderbilt University Medical Center.
The Chinese health authorities and the government of China are doing a ginormous public health experiment, the largest in the history of humankind. They are quarantining millions upon millions of people in an effort to reduce the spread of this virus. Down the road, we may be able to assess how effective that was, but it is a terrific attempt to reduce the spread to other parts of China and, of course, to other parts of the world.
The virus may be new, but it's a lot like others we've seen before. And that's one reason health authorities were so concerned when it surfaced.
Coronavirus is a member of a whole family of viruses, which the human strains give us colds, nothing more than that. But it seems that they also, many of them, live in animals. And occasionally, these animal coronaviruses jump species and can infect humans. And we've had a couple of examples of that in the past. There was SARS back in 2002, 2003, and then another one which we call MERS, the Middle East Respiratory Syndrome viruses. They came from, respectively, civet cats and bats and camels. The SARS virus had finally a mortality rate that was down around 10% or thereabout. That's pretty darn high. It was spread best by people who were already very, very sick. This virus appears to have a much lower fatality rate, thank goodness, but it appears at this juncture to be more readily spread from person to person.
Coronavirus is spread the same way colds and the flu are spread, through the air, often by coughing or sneezing. And while you may see videos of people in China wearing surgical masks to try to keep them from getting sick, Schaffner says that doesn't really work against coronavirus or the flu.
Why is it that the CDC does not recommend the use of masks during every influenza season? After all, Influenza is a respiratory virus that is transmitted exactly the same way the coronavirus is, or very similarly. And the answer is that the scientific basis for the use of masks by the general population, not the healthcare workers, but the general population, is scanty at best. There's no real evidence that that helps. And I would add that the surgical masks that people can buy in their drugstores are designed not to prevent the acquisition of viral infection, but to prevent surgical infections.
The chances of getting coronavirus are very low in the United States. At first, it would look a lot like the flu, with fever, a cough, sore throat, and just feeling sick.
Anyone could potentially get a coronavirus, but those who get truly sick are usually those with the more severe cases are those with weakened immune system. Perhaps they've got cancer and they're on chemotherapy agents or a transplant and on immunosuppressants, and the elderly, folks that are in general have less hardy immune systems.
That's Dr. John Mark Hirshon, professor of emergency medicine, epidemiology, and public health at the University of Maryland, and chairman of the American College of Emergency Physicians.
And so for most people, it would, again, you can get a really bad cold, you may get sick, but for most people, it's not been a life-threatening problem. We're much more likely to get people coming in and say that they think they have it, and then when you start talking to them, they don't. Well, we had a patient the other day, or someone who called in, they were concerned, their roommates were concerned because they had just gotten back from Hong Kong, but when we started talking to the individual, the person really was not at risk. They weren't in a place where there was transmission, and we were able to reassure her and reassure her roommates that it was not the coronavirus. And we're going to see many more of those type of folks who are anxious and concerned when they really have no risk for it.
Coronavirus has been around for only 2.5 months. China reported it to World Health officials just before New Year's Day. So there's still a lot about it we don't know. For example, we're unsure of the number of people who may have been infected and have no symptoms at all. So the American public health response for now involves what Hirshon calls the 3 I's.
The key for this is what we do, which is to identify, isolate, and inform, and those are really the 3 I's. And so first is we need to make sure that we identify who's at risk and who has it, who are true disease cases and potentially people who are at risk. And then we need to make sure we isolate them so other people don't get infected. And then we need to make sure that we keep people informed as to what's going on and why. So the 3 I's.
However, if you're really worried about getting sick, people in the United States might be best concerned about a 4th I, influenza.
At the moment, we have a large epidemic in the United States of coronavirus anxiety. In contrast, for example, influenza has caused, or is active in every state in the country right now. It's caused thousands of hospitalizations, and I'm afraid by the time the season is over, there will be thousands of deaths, once again, attributed to influenza. So of the two, in any immediate sense, influenza is the greatest risk.
And though the flu season is well along, Schaffner says it's never too late for a flu shot. Just be sure to put it on the calendar for next fall as well. Our studio producer is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Would be one shot that gives you enduring, potentially lifelong protection against heart disease. So in that case, it is kind of like a vaccination against heart disease.
New tools to tackle high cholesterol with a tantalizing hope for the future.
Then, using big data and artificial intelligence to help pick treatments. But it won't replace your doctor.
The machine can't tell you which treatment is going to work best for a particular patient, but it can narrow it down to a dozen or so choices.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.